Hello, everyone. I'm very happy to join you in this session and speak on reaching the unreached. And when we talk about reaching the unreached, I'm going to share today the experience of ILO's approach, in which we developed a program on voluntary counseling and testing of workers. In short, VCT at work. So I will talk about why we did it, how we did it, what tools we developed, and what are the lessons that we learned. So basically, the idea is to answer three questions. Was first, who are not being reached? Second, why are they not being reached? And third, how can we reach them? So as we developed this program called Voluntary Counseling and Testing of Workers, VCT at Work, actually, we developed it in 2013 along with UNAIDS and a couple of other partners, International Organization of Employers or International Congress of Trade Unions, and a number of other partners, including civil society organizations, global network of people living with HIV. So we basically had these three questions in mind when we developed this program. So first of all, and this situation is still very clear that actually, in general, men are not being reached in the AIDS response because when we compare men against the global 95, 95, 95 targets, um, they are lagging behind in comparison to women. So globally, women 92% know their HIV status, but only 84% men know that they have HIV. Secondly, those who know their status, are they accessing treatment? 83% of women who know their HIV status are on treatment, whereas only 73% men are. And third, 95 is those who are on treatment and have achieved viral suppression as a result of effective treatment. 79% women are there, but only 69% men. So when we see this, and this is coming from UNAIDS 2025 report, men are actually lagging behind in all the three targets. First, knowing their status. Secondly, being on treatment. And third, the effectiveness of treatment in terms of suppressing the viral load. So keeping this scenario in mind, the idea was to reach out primarily to men because they were being left behind and they are still. But it's a very big group. So who are the men who are not being reached? Men who are in the informal economy, men who are mobile, men who are migrant workers. And since workplaces bring large amount of them people together, the program was to offer HIV testing at the workplaces. So the first approach that this program adopted was a rights-based approach, um, because the question was, why don't people test? Is because stigma and discrimination. They feel their jobs will be lost if employers come to know that they have HIV. So these are the things which are stopping workers to take the HIV test. Then again, convenience of workers to go to a health facility and take the test, particularly for an informal economy worker, was another big constraint. So we adopted a rights-based approach, which means assuring workers that they will not lose their job. Their rights will be protected through HIV workplace policies, which were developed in line with the ILO's recommendation 200. So that was the first pillar. Second pillar was developing strategic partnerships between world of work actors and national AIDS programs, between Ministry of Labor and Ministries of Health, between private sector involving trade unions, employers organizations, networks of people living with HIV and AIDS, and also civil society organizations who have the expertise to work on HIV and AIDS. Those strategic partnerships played a huge role in the initiative. The third pillar was advocacy and communication, because to create demand and tell people, enhance their risk perception that they need to take the test even when they are physically fit and healthy, because HIV goes unnoticed for years and there are no immediate symptoms and exclusive symptoms. So this was another reason why people are not coming to take the test. So telling them that HIV goes unnoticed for years, it comes without any specific symptoms in the beginning, and therefore taking an early test when you are still healthy and fit is a good idea. Then you can, if that is the case, you can start the treatment. So advocacy played a very important role to enhance risk perception and create demand. Then the next pillar was linking people to care and treatment. Those who were found HIV, the idea was to immediately connect them to receive antiretroviral treatment, and not just antiretroviral treatment. We also enhanced access to social protection and other care mechanisms that they were needed. Monitoring and evaluation was another feature. Like in any program, you got to monitor how many are you reaching, how many of them were put on treatment, etc. So and what is the gender breakup of people you reached. So monitoring was an important aspect of the program. As we implemented, HIV self-testing became available, and we developed a policy brief along with WHO to do HIV testing at the workplace, where guidelines were developed, and HIV testing became an important tool, which was very well received by workers. And the last pillar was adopting an integrated testing approach, the overarching health and wellness approach at work, because employers were very keen on a broader framework of health and wellness within which they wanted to do HIV work. So we did HIV testing, but not HIV testing alone, along with testing for blood sugar levels, hypertension, tuberculosis, and other conditions. It required much more coordination with different service providers, but it reduced stigma related to HIV testing alone, and it also was useful for workers to access a health camp or an event and get to know their health status much in advance. So these were the pillars of VCT program. The approach was we prioritized workplaces which already had a workplace policy and program, because we wanted to build on the awareness work which had already been done, the policy which was promising non-discrimination, the policy which was protecting, assuring workers that their confidentiality will be respected. And those elements were reinstated and clearly reiterated in the approach of VCT to keep a focus on human rights. We also felt adopting a sectoral approach to reach men at risk would work. So we worked in construction sector because they engage a lot of mobile and migrant workers. We worked with transport sectors, in mining, and in different sectors. In some countries, people also adopted agriculture sector or tea plantations where they implemented programs, because these programs were also allowing, and as we implemented, we realized that it allowed us to reach clients of sex workers, because they were also coming from the mobile and migrant workers, sometimes youth as well. And the beauty of this approach was that we could leverage existing workplace resources, which means the people. So we trained peer educators in every workplace where we implemented this program. They were given tools and to educate their co-workers. Uh, we used structures which exist in some workplaces, like workplace clinics, occupational safety and health programs, wellness programs that exist in workplaces. So we built on those existing infrastructures and programs, and that actually ensured that programs were much more sustainable if capacities were built, and there were also resources available, so much more um, technically sound and financially sustainable. Partnerships I spoke about played a very important role, and ILO's role essentially was to bring all the partners together, use the ILO's convening partner role, and then provide technical support in terms of policies and programs and training of peer educators, linking them up with different service providers. Last year, on 1st of December, we have produced a global report, which and the link of this report is inbuilt into these pictures as I speak. One could see this program captures the results, good practices coming from different countries, which is very, very interesting to read, and the lessons. In short, the conclusion of this report is that workplace-based rights-driven approaches can significantly expand access to HIV testing and services while reducing stigma and discrimination. And we also showed that this program reached populations who are often left behind, such as men, informal economy workers, refugees, clients of sex workers. And we reached them not only with HIV testing, but we also linked them to social protection and other important care and support mechanisms. We developed two tools. On the left of your screen, you will see there's an online training program that we have developed through our International Training Center in Turin, Italy. This is a free course. Anyone can do it who wants to do workplace programs on HIV testing. It's called HIV testing at the workplace, but it also has modules on addressing stigma and discrimination, training of peer educators, monitoring and evaluation, workplace policy. So it comes with 9 modules, and people can do it in about 6 to 8 hours, depending upon how fast they do it. We also developed a toolkit, the second picture that you see on the screen, which is for training peer educators on HIV workplace programs and voluntary counseling and testing. This lays down an agenda for the training program, different sessions, session objectives, methodology that people could adopt, and lots of training tools, including some presentations which can be updated, adapted to suit local contexts and used by the workplaces. So I strongly recommend people to make use of these two tools that we have developed. So what did we achieve? Just to present the last 3 years picture between 21 and 2024, we were able to reach out to about close to 2.4 million people. About 1.8 of them were men, which means it showed that by targeting industries which engage men in a large number, one could reach out to men who are not coming to health facilities so often. 1.4 million workers came to know of their status as a result of this initiative in last 3 years under mentioned, and 1.1 of them were men. So this shows that majority of men were being reached. About 48,000 workers were tested positive, 37,000 of them were men. So this also shows about 3.38 HIV positivity rate amongst men through workplaces, which is okay, because these are the men who are not coming to workplace to the testing and facilities anyway. And then close to 100%, almost 97% of them were linked to excess HIV treatment. So this shows that HIV testing at workplaces, if done properly, linked to treatment, is effective. It allows us to reach men. It allows us to reach men who are at the risk, particularly those men who don't visit health facilities. We also did a qualitative study in Nigeria on the efficacy of HIV self-testing, and we found that respondents, most of the workers, mentioned that there are several advantages of HIV self-testing. First, it's simple, it's convenient, it's non-invasive, it's less stigmatizing, saves time and cost, particularly the opportunity cost for workers to go to a facility for an initial screening. But this study also showed that HIV testing works, self-testing works, but it needs to be accompanied by awareness sessions at the workplaces, and peer educators played a very important role in creating demand and knowledge. And they were the ones who were actually distributing self-test kits. So workers knew whom to contact in case they had more information. And then how to use the self-test kit was demonstrated in training programs, and peer educators also lent their support to them. And we also realized that workers are now saying if the test kit costs are further reduced, it will greatly enhance the uptake. Now, these are the numbers. We also partnered with the UnitAid and a number of other NGOs who are working with the UnitAid project in 7 countries, mostly in Africa, but also India and Indonesia. And here also the same results. We found men were reached in big numbers. And most important thing is that a great number of them, about 16% of them, were first-time testers. So HIV testing at work, including HIV self-testing, allows us to reach first-time testers, as well as those who don't test too often. So it's a very important strategy. And on the picture that you say, this is the policy brief we talked about. ILO developed with WHO on how to do HIV self-testing at the workplace. And then another document we produced on HIV self-testing, what are the approaches to implementation and sustainable financing. This document also comes up with good practices and also the examples from different countries, including Africa and Asia. One element that we implemented, as I said, to enhance access to social protection through VCT, because as we were doing program in several countries, including India and Uganda, Kenya, we started enrolling people, particularly the informal economy workers, migrant workers, into the government social protection schemes and health insurance schemes. And we realized that workers were not aware of those schemes, and they were not sure how to access those schemes. So the idea was to map the schemes in a country, and then make workers aware of them, and facilitate workers registration into those schemes. So this our partner in Gujarat, GAP, implemented a hugely successful program for a number of years, reaching out to migrant workers and then registering them into social protection schemes of the government. There are lots of schemes of the Labor Welfare Department, including so they make an e-Nirman card or the e-construction card. And this worker said that I had lost hopes when I was detected positive for HIV, but due to counseling and treatment, I am working again. So on one hand, the person received ART and started working again. And secondly, he also got to know about this e-Nirman card of the government labor department's scheme. And through this, he could get a land to construct his house. He said, all this happened because I got correct information at the right time. So over 100,000 migrant and industrial workers were reached by GAP, and majority of them were men. This good practice is documented, and the link is there on the screen. We have also demonstrated that VCT at work, actually when implemented with migrant and mobile workers as well as youth, allows us to reach clients of sex workers. So we actually prioritized some of the workplaces which were close to sex work sites. In Kenya, we worked with truck drivers as well as sex workers. And this sex worker said that truck drivers are our primary client. Following the joint awareness sessions for truckers and female sex workers, it has become easier for us to negotiate safe sex with truck drivers. So these kind of experiences are coming up, hugely important, and the same things as acknowledgement by the Ministry of Health colleagues that self-testing is a great way to reach mobile and migrant workers as well as clients of sex workers whom we could not effectively reach earlier, as you see in this message. Truck drivers themselves have welcomed this initiative because this truck driver from Kenya says getting information on how to use self-test kits and getting the self-test kits at the truck stops is a great idea. I don't need to worry about parking my truck when I go for a health test in a health facility, and I can test at my own convenience. Having talked about the approach, now I'll just talk about 5 lessons to close my intervention. So first lesson here is that engaging workplace leader has helped. We have done CEO testing. We have done testing of trade union leaders. We have done testing of senior people in the workplaces. So to show that it's not only for worker level people only, it's not just for floor shop workers. And then assurance by management that workers will not lose their job if they test positive. For example, this message coming from the HR manager in Sri Lanka. I have taken the test myself, and I encourage my employees to do the same. Those who test positive should not worry. Their jobs will be protected and they'll be taken care of. So these kind of testing events involving CEOs and capturing these messages, putting them on the walls, on the intranet of companies helped a lot. It created a conducive environment for everyone to come forward and take the test. Second lesson is we communicated the benefits of testing early. It allows us to stay healthy. It allows us to stay fit. It's easy, it's convenient. So as we implemented the program, we kept on capturing the messages coming from the users, the workers, as well as leaders who were talking about benefits of HIV testing. And we developed a social media campaign, as you see some of these messages I'm flashing, to talk about. And these are cost-effective campaigns which can be done in any situation. Ignorance is not good. I took the HIV test. Don't be scared. So these kind of messages helped on communicating the benefits of testing. We also learned the third lesson is that VCT at work has triggered public-private partnerships, and it has allowed us to use additional resources, leverage additional resources. We have worked with business coalitions in Mozambique. We have worked with employers organizations, enterprises in almost every country. And this is an extremely useful strategy to strengthen public-private partnerships for HIV response. As we were implementing, we were constantly capturing positive stories of this impact VCT at work was making on workers. So wherever workers were comfortable, they were giving consent. So we were capturing their case studies and we're putting them into short videos or sometimes just writing about them on a website or on a poster. So people were talking about was this lady had lost her job, but in her company when this VCT program started happening, they realized that the VCT HIV with HIV people can work, and HIV does not spread by day-to-day workplace contact. So they called her back. They gave her job back, and these kind of positive stories were collected and disseminated. So finally, the lesson is workplaces can close gaps in HIV testing for men as well as reach out to those who are not being reached effectively for a number of reasons which I've talked about. So as we are talking about in this conference, as we are rethinking, rebuilding, and rising, so we need to rethink about our HIV testing approaches, and VCT is a good model to be kept in mind. What can be done at workplace? Potential of workplaces has not been fully utilized, and that needs to be done. We can rebuild and rise to the occasion, and I hope um, participants will find these few tips and lessons useful and make use of these tools that are presented. Thank you very much.